Hey everybody, it's Sunday morning. So let's take you to church and continue our deep dive, take a breath, into the female anatomy. So we've already covered the overall anatomical structures and we covered the labia majora and labia minora. Today, we're gonna focus on the really important structure called the clitoris. I don't care if you're male, female, or anything else, pay attention to this one, okay? It'll help you. Promise. Now, the clitoris is a full organ, and it sits at the apex and is often referred to as a bundle of nerves, which is not incorrect. It is actually thought to be somewhere around 10,000 or more nerves concentrated right here. This would actually be analogous to like the tip of the male penis. Now, here's where so many people get it wrong. It's not just right here. This is a full organ that actually starts here and is underneath of the clitoral hood. As you can see, this is the bulb and this is the hood. Again, it's not hiding. I don't know why people act like it's hard to find. It's literally right there. But that's not all. It also stems down each side, and those arms coming down are full of nerves. This is actually what it looks like. So if you can imagine, it sits right here. It's a big organ, all of which is full of nerves. The top here, this bulb, this is what's covered by the clitoral hood, as you can see. So this is really all that's showing. This is also made up of incredibly sensitive erectile tissue. So much like the labia minora, during arousal, this can become engorged and actually increase in size and sensitivity. These bulbs that come down actually come down either side of the vaginal opening. So again, full of nerves and sensitivity. So these are important areas as well. This full structure is important and deserves care and attention. Now, here's something that I feel like is not talked about enough, because it's important that we not only talk about what the structures are, but we talk about their purpose and their function. Now, here's the thing. For anybody out there who, I don't know, let's call them a little prude this Sunday morning, I assure you, God cares about a woman's pleasure, because this bad boy, this full organ, serves one purpose and one purpose only that we know of: female pleasure. So that matters. And if it's designed, then clearly it matters. So there is another important thing that I want to make sure you're aware of. If you can picture 10,000 nerve endings right here, and yes, it is important to pay attention to and give appropriate, awareness of. But that much nerve sensation can also be painful with too much stimulation, too much pressure, and things like that. So it is incredibly important that you are careful. Talk about how some things can change throughout your life cycle. As women age and things change, and you do experience some atrophy of the tissue. You can have shrinking or atrophy of the labia and of the clitoral hood, which can actually leave the clitoris more exposed. Now, you might think that this would make it more sensitive, and for some women it does. But for other women, they find that as they enter perimenopause or menopause, that it actually becomes more desensitized to touch or to stimulation. So that's not uncommon or abnormal. Additionally, there are lots of medications that can decrease the sensitivity of this area. So it's important to know that if things change and your responsiveness to sensation here is different, there may be a reason, and it may be something that can be addressed. So speak to your healthcare provider about this. Again, I'm going to keep saying this. We have to have open, honest, normal conversations about the human anatomy, about the female anatomy, and about things like intimacy and pleasure, because that is the only way we are going to end the taboo and set people up for confidence in their bodies and who they are as people. Set them up for healthy, satisfying, intimate relationships, because that is what people deserve. So end the stigma. If you're a healthcare provider, start these conversations with your patients. I've never had a single patient tell me that, oh yeah, I don't need to talk about any of that. I don't want to talk about any of that. Most of the time, it is immediate word vomit about all the things over the years that they have experienced and wanted to talk about and didn't feel like they could. And that is a failure on healthcare and healthcare providers. We've got to do better. The education system needs to do better. The healthcare system needs to do better. And people need to do better speaking up and advocating for themselves. So, we're going to continue this in another part, but there you have it. The clitoris, a full organ, not to be ignored or disrespected.